I am joined tonight by the newest member of the Lakewood Oncology team, Jamie Nordick. Jamie, you have been with us now for, I believe, just a little over a month, correct?
Yes. December 13th, I started.
December 13th. Fantastic. So tell us a little bit about yourself. Tell us a little bit about where you're from, your family, where you're, and all of that good stuff. And then a little bit about your background as well, too.
Absolutely. Well, thanks for having me. So I am from the Rothsay area, which is a little bit of a hike from Staples, but I am a mom to two little kiddos, Griffin and Brecklin, who are just turned 6 and then will turn 9 here in just a few short days. And married to my high school sweetheart, and we just enjoy all things outdoors, ice fishing, the lake, in the winter and the summer is perfect for us. And as for my background, I'm a registered nurse. I have spent my entire career in oncology, which used to not feel as long, but it's been 17 years and 11 of those I've been in leadership. So
Goodness.
I'm a little bit of I'm in oncology. That's my wheelhouse and that's my passion.
Got it. Well, fantastic. I know we're so excited to have you here as well. Tell us a little bit about maybe what some of your priorities are for the next couple of weeks, for the next couple of months. I know always fresh and new in a position. It's always a million different things probably coming at you at once. So talk a little bit about the program and maybe some of the things that you've noticed so far in your short time that you've been here.
Yeah, absolutely. So I just have to say, I feel like I have stumbled upon just a really great culture in general. The team that I have been able to kind of come into have been so welcoming. They are kind and caring and so compassionate. And so I feel like my biggest priorities right now are to figure out how to best support them so they can continue to provide that top level care to our patients and their families. And then in the same time frame, I'm also looking at ways that we can continue to build our workflows and our processes to just really provide that next level care for our patients and their families, because as we all know, a cancer diagnosis doesn't just affect the person, it affects the entire family. So I think our biggest piece will be figuring out how to just help support the good work that's already happening, and then also take this to the next level with some possible nationally recognized accreditations that will also solidify that we are providing safe care.
Oh, that's so fantastic. Unbelievable. In the short time that we've sort of been building the program, even it's just been gangbusters from the start. Dr. Swenson has brought so much to this organization, and he's meant so much to so many patients already as well too. The other part of this that I wanted to chat with is, as you know, it's sort of a question for you that I also wanted to ask Jessica if we're able to see if we can get her. It says, I was checking to see if Jessica was on. We're having some internet issues, so we want to wait. She went over to a family member's house. All right, let's see.
Oh, and it just says Jessica Nybakken joined, so maybe?
Look at this. I think she's going to pop on. I just accepted.
Yay! Jess!
You're there, but you're sideways. Can you turn your phone so we can see you? There you go. All right.
Hey, Jess!
Hi. Sorry about the trouble.
Hey.
No.
Thank you for being persistent and making it work. We appreciate it.
Yes, you bet.
Awesome. All right. It's good to have you with us. For those of you joining us tonight, Jessica Nybakken is one of Lakewood's newest oncology providers, and she is nice enough to join us tonight. She is an advanced oncology certified nurse practitioner. We'll jump back. Jamie told us a little bit about herself. Jessica, tell us a little bit about yourself, your family, where you're from, and then a little bit about your experience. That'd be great.
All right. Well, my name is Jessica Nybakken, as Matt said. I'm an oncology certified nurse practitioner. I joined the Lakewood Health System team at the end of October. I am from the Breezy Point, Minnesota area. Okay. I have a wonderful husband named Brent, 3 awesome boys, Hunter, Tyler, and Bodie. My oldest 2 are in college at the University of St. Thomas and Iowa State University. And my youngest is a 9th grader at Pequot Lakes High School.
All right.
I have worked my entire 27 years in the field of oncology. I've worked inpatient med-surg oncology, outpatient as a chemotherapy nurse, bone marrow transplant, and for the last 15 years, I have worked as an oncology nurse practitioner.
Okay, fantastic. I know we're excited to have you. This team just continues to grow. It's new faces. It's always fun to see new people in the hallway and walking around and seeing patients. It's just an exciting time to be at Lakewood. So I'll just follow up questions now. You joined us around the end of October last year and sort of your time frame. So tell us a little bit about what that transition has been like, coming to Lakewood. You were at a larger facility before joining us. We're in a little bit of a different position in the fact that we're growing a program from the ground up, and it's a super exciting time. So maybe what are some of the differences, and what has your experience been like here with the culture and treating patients here at Lakewood?
Sure. The transition has been really great. When I was contemplating making a career change, I was really impressed with both the administration and Dr. Swenson's vision, goals, and values for the oncology program. I feel like they really align with the values that are important to me in my own life, and also as an oncology provider. Yeah. Working with Dr. Swenson, our oncologist, is inspiring as well. He has such a passion for rural healthcare, which is new to me, and I'm just thrilled to be a part of the team learning about that. As we all know, receiving care in a rural community, often leads to barriers of care, both in regular healthcare, but especially in specialty care. Folks often have to travel great distances to see providers, to receive their treatment, which can lead to increased expenses, but most importantly, time away from their family and friends. So the vision that Lakewood Oncology has for creating a comprehensive cancer center is hopefully going to alleviate a lot of these barriers, allowing patients to receive care in their own community, in their backyard, close to their friends and family, getting them back to their homes. We all know we do better when we sleep in our own beds, we heal faster, and definitely feel better. As far as the culture here at Lakewood, it's so impressive. It is the most calm and comfortable place, both as a patient, I think, but also as a provider to work at. Everyone is kind, friendly, happy, and really willing to help each other out, which has been really great to be a part of. As far as our oncology team goes, I'm honored for outstanding oncology nurse practitioners. Both Alyssa Manning and Mariah Neiman have been just wonderful to me. They've welcomed me with open arms, and I just truly love having nurses to collaborate with, especially in tough clinical situations. So it's been a great first start.
Oh, wow. Well, you know what? You do have a good crew. I've had a chance to spend some time with all of them, and they're just amazing people. They care. They have a lot of passion. You mentioned Dr. Swenson. I get exhausted just being in the same room with him. He's so busy. You know what I mean? He's writing. He's going to conferences. He's just such a thought leader when it comes to rural healthcare. He's amazing, and we're just so fortunate to have him here. So.
Great. Yeah. And I didn't mention, I haven't met Dr. Emily Westergaard yet.
Yes.
I'm excited to meet her in the future. I think it's the end of summer she'll be joining our team, which is going to be amazing.
Yes. Yeah. She will be here joining us sometime in the end of summer, so that oncology provider group just continues to grow, and more capacity, more capabilities, and extremely exciting. Jamie, back to you. Anything you've noticed about the culture? Anything different about Lakewood than any previous experiences that you've been a part of? I know you're still kind of getting your feet wet, but anything that sort of stands out to you as well too?
To be very honest, I've been working in a consulting role with Lakewood for about a year, and in all honesty, that year was the reason that I chose to work so far away from home. I've never been able to experience exactly like Jess shared. It is welcoming. What you see is what you get. Leadership, the providers, it truly is. When they say that patient care is top priority, that is exactly what it is. We're going to make it work and it's going to work best for the patient and the family that we care for. So just everything Jess said, the best culture that I've been able to work in.
Well, that's fantastic. I'm so glad to hear that from both of you. It's exciting when you have new people that can come in and kind of feel that right away. We're doing something. We're all about the orange, as many people know. I'm on the couch and everything else. So yeah, we're building it up. I can just echo that a little bit. So I shared this with you earlier today, Jamie, and Jessica. But I had the good fortune. You talk about the care and the patient focus. I had the gift to sit down today with a patient of ours who has been through treatment at Lakewood, and she had so many wonderful things to say, not only about the care that she received, but about the providers, the infusion therapy team, the nurses, everyone that she interacted with, mental health therapists, case managers. She just listed them on, and she got very emotional when she talked about it, because she's just had such a beautiful experience. It's been a difficult experience, as many cancer patients all know all too well, but she's also had an extremely, just a wonderful experience, and she wants to tell people about it. So we're super excited to tell her story. That's coming in the future, but I just wanted to kind of let people know about that too. So it just warms my heart to be able to sit down with patients and know that the story we're telling is real, and the folks that we're having an impact on is real as well too.